Hello, I'm Donna Cryer, founder and CEO of the Global Liver Institute, and I have the honor and privilege of bringing you our liver cancer lessons, where we bring to you vital information around liver cancer and hepatobiliary cancers, particularly throughout our October is for Livers campaign from experts from around the United States and around the world. Today, I am honored to have with us Dr. Amit Singal, Medical Director of the Liver Tumor Program and Chief of Hepatology at UT Southwestern Medical Center. Today, we're going to be discussing screening for liver cancer. Dr. Singal, welcome and thank you.
Thanks, Donna. Excited to be here.
So, who is at risk for developing liver cancer?
Yeah, Donna, it's a great question. So when we think about hepatocellular carcinoma, the most common type of primary liver cancer, this primarily develops in patients with underlying liver disease. And that liver disease can be from any host of different causes. The most common cause worldwide is actually chronic hepatitis B. But when we think of the Western world, the United States or Europe, the most common causes have been hepatitis C, alcohol-related liver disease, and now something that's becoming more and more common in our clinical practice called non-alcoholic steatohepatitis. And these are people who have other metabolic symptoms. So they may have obesity, they may have diabetes, and this is the liver manifestation of that constellation of diseases. Any of these etiologies over time can cause chronic liver disease and cirrhosis. Once you have cirrhosis, people actually have an annual risk of developing liver cancer somewhere between 2 to 4%. So just to put that in perspective, that means if somebody has cirrhosis for 3 years, their risk of liver cancer goes up to be 10% or higher. So the longer you have cirrhosis, the higher your risk tends to be. So currently the recommendations for hepatocellular carcinoma are to perform liver cancer screening in anyone who has cirrhosis from any cause. And there are subsets of people who have chronic hepatitis B, and that's usually determined based on a combination of age, sex, and a family history of prior liver cancer. And so determining, those different factors, there are some people with chronic hepatitis B who are at high risk and should be screened.
And so what does liver cancer screening look like? What should a patient expect?
Yeah, so the nice thing is that liver cancer screening in terms of the actual tests is pretty simple. So it's typically done with an abdominal ultrasound. So this is a non-invasive test where you come in and it's about a 30-minute exam. Just to, for anyone who hasn't had an ultrasound, this is the same thing that they use when they actually do, baby exams. So this is the same, so it's a very simple test. And it's combined with a blood test, and that blood test is a cancer marker called alpha-fetoprotein. So the two tests are pretty simple. The one difficult thing about liver cancer currently is the fact that we have to do it every 6 months. And this really speaks to the fact that people who have any of those conditions that we talked about, either cirrhosis or chronic hepatitis B, are at such high risk, and they continue to be at high risk. And so we need to currently do those tests at very short intervals of every 6 months.
And so who determined that these were the guidelines for how and who should be screened for liver cancer?
Yeah, so the guidelines were developed by professional societies across the world. So actually, most of the professional societies agree that it should be ultrasound and this blood test every 6 months, including those from the U.S., Canada, Europe, Asia. All of the guidelines have converged upon this recommendation, and that's really based on a lot of data over the last several decades. Showing that this actually helps detect cancer early, helps facilitate curative treatment, and improves overall survival. So it's really based on a lot of data, but it's nice because all the guideline societies have really agreed upon these recommendations.
So if we know that, if we know the diseases and conditions that drive liver cancer, if we know how to screen for liver cancer, And there is a consensus amongst the data and and the medical societies around the guidelines and the process and the interval every 6 months to bring people in for liver cancer screening. Why is it not being done?
Yeah, I mean, that's the $1,000,000 question, right? So it seems so easy. I mean, it seems like we have the cookbook there. Why can't we make the cake? And really, it comes down to, while we were talking, and it seems so simple, when you actually implement this in clinical practice, it becomes much more difficult to do. So we've actually done several studies where we've looked at different barriers across the spectrum. And the most common reason why this isn't being done is because providers sometimes don't order this in at-risk patients. And when we've actually gone and conducted survey studies among providers, there's a couple reasons that come to the top. The first is that there sometimes is a lack of awareness. And so, this really highlights the importance of what GLI is doing in this area and getting the word out. The more we can let all providers know that this is something that we need to be concerned about, the more that we can help make this happen. The second thing is, from a provider standpoint, it's sometimes tough, right? Patients they come in with urgent medical conditions, they have things they want to discuss, and then you have to discuss screening. And this is all done in a relatively short visit. And so sometimes these things, unfortunately, just fall to that bottom, of that priority list. And then, even though obviously we both agree it's quite important. Then also, when you take a look at this, even if providers order this, when you go to patients, there's also patient barriers. So, when you talk about doing an ultrasound, that's a separate visit. So that means more work. That means, sometimes for people, particularly patients of low socioeconomic status, that means finding another ride or, getting another bus ticket. So that can be quite tough. And then there's copays and deductibles. And so you're talking about additional financial barriers. And so when we've taken a look at that, there's about 15% of patients who report some of these barriers to having liver cancer screening done. And those people who report those barriers are actually, when you take a look at their charts, significantly less likely to get this done. So this actually translates into lower screening rates. And to your point, when you take a look overall, when you take a look at the US population of patients with cirrhosis, only 1 in 5 patients with cirrhosis are currently having liver cancer screening done. So this is a huge area of need. This is where we need a lot of work to get that number up from 20% up to 80%, 90%, because that's where the other cancer screening programs are. When you take a look at breast cancer and colon cancer, they're at that 70, 80, 90. We have a long way to go and a lot of work to do for liver cancer screening.
Well, I'm very glad that we have you on our side and part of the GLI Liver Cancers Council to help us achieve that goal. Thank you so much for being here today and explaining this issue with such clarity. Thank you, Dr. Singal.